I thought I'd just quickly explain what high yield information is. So this is information that we need to know, stuff that will be tested on and will come up in our exams as well as day-to-day life on the wards or in our practice. So you want to think of high yield information as what are the most important pieces of information that you need to know in order to be a functioning doctor. So for example, when studying biochemistry, you want to know the different amino acids, what group they fall into, are they essential, non-essential, what are their specific properties. Those are high yield. When we're studying anatomy, you want to know what is the main innovations, what are the main vascular pathways. For physiology, we want to know the difference between the systemic circulation versus the pulmonary circulation. When we're studying things like obs and gynae, you want to know the APGAR score, you want to know different types of postpartum infections. You want to know what are teratogenic drugs, so what should pregnant women not take. So it's information that you need to know, things that will be examined on again and again and again. And the reason why I say high yield is because if you know this information, chances are it will come up in the exam and you'll get the marks. So how do we know what high yield information is? Well, like I said, what is the information that the lecturers focus on? So what topics do our lecturers focus most of their time on? And when we're doing past papers, what questions and what topics constantly come up? So for example, when doing clinical radiology, chest x-rays always come up. So understand how to read a chest x-ray. The difference between pulmonary edema versus consolidation you see in pneumonia. What does it look like when we have a collapsed lung? How does tracheal deviation affect our diagnosis? Those are high yield information that you need to know. Also, when we're doing past papers and question banks, certain information will come up again and again and again. For example, teratogenic drugs, different types of antibiotics, and which ones you can give for different types of infections. Those are high yield information. So I hope that this helps. If you guys are still confused, put a question in the comments and I'll make sure to address it.